Hand, foot, and mouth disease by Chanel McBain. Hand, foot, and mouth disease is a viral illness common in children under the age of 10. Teenagers and adults can also contract the disease, however, this is less common. It is usually a mild disease but can affect the heart and the brain and may even lead to death. In regions where the virus is endemic, it's more common in the summer and fall and year-round in regions with warmer climates. HFMD is primarily caused by the Kawasaki virus. The Kawasaki virus belongs to a group of viruses called non-polio enteroviruses, and they are also known as picornaviruses. The Kawasaki virus is originally found in the town of Kawasaki, located south of Albany in Greene County, New York. There are two different types of Kawasaki viruses, A and B. Type A can cause sores in the throat and hand, foot, and mouth disease. Both type A and B can cause meningitis, myocarditis, and pericarditis. The most common cause is Kawasaki virus strain A16. Also, enteroviral strain 71 has also been associated with cases of outbreaks of the disease, in rare cases also encephalitis. The symptoms, as the name suggests, is a hand, foot, and mouth disease. Classic signs are maculopapular rashes on the hands and feet and around the mouth, in addition to herpetic ulcers in the back of the throat, and can also be accompanied by fever, sore throat, feeling of unwell, painful blisters, blisters on the palms and soles, and sometimes the buttocks, irritable or cranky infants and toddlers, and loss of appetite. Transmission, the most likely route is the fecal-oral route. The illness is spread horizontally, usually through direct person-to-person contact with an infected person's respiratory droplets sprayed in the air after a cough or sneeze, sharing of eating utensils and cups, nasal secretions or throat discharge, saliva or fluid from blisters. Even after symptoms have ceased, the virus may still be present in the feces. And even though transmission is most likely during the first week, the virus can remain in the body even after signs and symptoms are gone. Some people, particularly adults, can pass the virus on without even knowing they have it. The incubation is usually 3 to 7 days and can range from 2 days to 2 weeks. Although both adults and children are affected, young children below the age of 5 are more susceptible. Usually fever is the first sign, followed by a sore throat, and then after that, painful sores may develop in the mouth or throat, and a rash on the hands and feet and possibly on the buttocks can recur within 1 to 2 days, usually by the loss of appetite. Places of transmission is most common in children locations such as child health care centers, daycares, and schools due to occasional use of diapers and potty training. Little children are also more likely to put their hands in their mouth and contaminated objects in their mouth. Young children are more susceptible to direct person-to-person contact. Children usually develop immunity to hand, foot, and mouth disease as they get older by building antibodies after exposure to the virus that caused the disease. However, it's still possible for adolescents and adults to get this disease. On October 23, 2015, the Government Information Service of Grenada released a statement, with cases of the hand, foot, mouth disease continuing to rise globally this year. Grenadian health officials are reminding parents and operators of daycares and kindergartens that frequent hand washing and cough etiquette is still the #1 defense against disease. And this was made after subsequent outbreaks in Jamaica and Cayman Islands. The disease in Grenada is endemic and is legally notifiable to the Ministry of Health. Grenadian officials also recommended this to minimize the spread of HFMD. Parents must inform their child's school or kindergarten or daycare immediately so they can monitor other children closely and take other precautions. Infected children must be kept home and away from public places, practicing good hygiene, covering the mouth and nose when coughing or sneezing, and properly disinfecting articles such as toys, tables, books, doorknobs, and appliances. Before returning to schools, children should be checked for runny nose, fever, blisters on hands and arms, mouth ulcers, and blisters on soles of feet or legs or buttocks. Doctor recommended treatment is getting plenty of rest, drinking fluids, preferably milk breaks, sucking on ice pops or ice chips, eating ice cream or sherbet, or eating soft foods that don't require much chewing. If necessary, over-the-counter pain relievers can be used, such as acetaminophen or ibuprofen. Aspirin should not be given to children. These pain relievers should be given to reduce high fevers, but will not reduce or hasten the resolution of HFMD. Mouthwash or topical anesthetic spray can be used to numb the pain. Since it is a mild disease, there aren't very many complications for HFMD. Other than the sores in the mouth and the throat can make it painful and difficult to swallow. And if dehydration is severe, IV fluids may be necessary. Also, in severe cases, you can have viral meningitis and encephalitis, although this is extremely rare. Prevention is simple. Taking precautions can help reduce the risk of infection with hand, foot, and mouth disease. Wash hands carefully after using the toilet or changing diapers and before eating. Disinfecting common and high traffic areas with soap and water and diluted chlorine bleach solution. Teaching good hygiene to young children on how to keep themselves clean and keeping foreign objects out of their mouth. And isolating contagious people, especially when symptomatic. Thank you.